Hello and good morning. Today we are going to discuss about OSCE that's performed by the Australian Nursing Council in Australian system. There are different type of OSCEs will be there. OSCE that is performed by the UK system, OSCE that is performed by the Irish system, where it's called as Irish Aptitude Test. UK was conducting this one for so many years, and Ireland was conducting Irish Aptitude for so many years. And recently, I presume it's around 1 to 2 years back, during the COVID time, Australia has started OSCE, and there are a lot of confusion and questions are there among the students how they have to perform the OSCE. Once they finish the difficult RN test and they are going to approach the OSCE test, it find it a bit hard for students. So myself, Bimel, I am one of the OSCE trainers in MWT Academy, and I am going to give you a brief lecture on how the student have to perform in the OSCE station in the Australian system. The Australian system is a bit different from the UK and Irish system, where there is a time constraint is there. In the time constraint, what's going to happen is you have only 8 minutes for the performance. But in case of the UK system as well as the Irish system, there are differences will be there. So we will discuss about how a student have to approach the Aphra OSCE Australian system and to get things passed in a good way. Okay. So today we will see the introduction, and thereafter we will have a series of discussions in which I myself will be talking about the different stations and how you have to approach in the different stations. If you have some questions, come back to us, and also if you have are looking for OSCE training face to face or online training, if you have some difficulty is there, and contact the number that's given in the description, so that you can approach us for practice OSCE as a training in our system. We have world-class training facility, and myself is the lead trainer over there. Okay, the OSCE scenarios. We will look into the OSCE scenarios. What they are going to give you is they are going to give you a station or a scenario in which you yourself have to perform that station. It can be IM injection, oral medical application, IV medicine administration, infusions, and stuff like that. We will discuss the stations one by one later. But you will be giving 2 minutes will be the typical scenario will look like they are going to give you a 2 minutes reading time in which a scenario will be discussed. The scenario looks like a person has gone for a party, or a person has gone for a cycling, or doing some gutter cleaning, or doing some work in the kitchen garden, and he had a fall, or he suddenly become unwell, and thereafter the patient is in the hospital, or patient is in the community or in the home. So you yourself have to go behind the patient and do some tasks. For example, you are asked to do a vital signs and escalate the plan, and you are asked to do a neurological examination and escalate the plan. You are asked to give you oral medicine administration. So all these things are usually the typical scenarios you will get. So you will be getting a 2 minutes reading time in which a scenario will be discussed in the tablet. Okay, so you have to scroll the tablet and see the scenario over there. It's like a storyboard over there. And after the 2 minutes, the second bell will ring, and then you have to approach the station. The station will be looking like a mannequin will be there either, or there can be an actor will be there, or a mannequin and actor will be there. Mannequin will be acting as a patient, and the actor will be acting as an next of kin over there. So usually the patients are quite okay, and sometimes there are scenarios in which a patient will be uncooperative. And what they are going to look into the station is not typically the task that you are going to perform. So what we have learned in our system is we are just doing the task analysis. Okay, you finish your task and you come back. No, that's not the system that's expected in the Western facility. Also in the Australia is pretty similar, where they are going to expect a high standard of nursing. That's called holistic care. So what is holistic care? We will look into that in a few minutes. But before that, I have to tell you what is going to happen in the station. So 8 minutes is there. So once you begin the task, you finish the task in 8 minutes. So 2 minutes prior to the station, there will be a bell will be there. So that's a warning bell. There is only 2 minutes left over will be there. So after the 2 minutes, what you can do is you have to finish things in 8 minutes. document everything, because documentation is very crucial in the Australian system. If you are not documenting, that's not considered as a practice that is being performed. So what you have to do is you document it and say thank you, and you can come out. So this is what is a typical station looks like. Then the other problem, once you have read the scenario outside and you have a station described for you, you will be getting a small handbook in which you can scribble some important points. For example, patient's name, diagnosis, some significant critical information. So you can keep it with you in a scribbled paper. That paper will not be evaluated by the examiner or the evaluation team that's in the station. So once you have it, then go to the station and then perform it. If you have some questions, you can go back to the scribbled paper over there where you have written all these informations. So this is what usually going to happen in the OSCE scenario. Once you finish, you come out, that's it, you complete the station. Then once you come out, there will be a next bell will be ringing, so you have to run to the next station, where also you have 2 minutes reading, 8 minutes performance, then 2 minutes reading, 8 minutes performance. So likewise, you have 10 stations will be there. Okay, once you finish the stations, the 10 stations, it will be roughly around 100 minutes. 10 into 10, that will be around 100 minutes. Once you finish the station, then you can come out. So the examiner will give you guidance, and examiner will direct you whether you can finish the station, and you can complete the necessary procedures, and you can leave the station by that time. So this is usually happening in the Adelaide Health Simulation Laboratory. They have their own way of doing the Australian system there. Then the other point you have to keep in mind is the time constraint. Only 8 minutes will be given for you. So that's a difficulty the student is going to experience. The other one is communication. So as far as the Australian scenario is concerned, what they are going to look in is the examiner is going to look in some important components. I told you there are mannequin will be there, and there are certain situations in which actors will be there. They are trained actors, and they will be acting as patients, and there are certain situations in which there will be actor plus mannequin will be there, where actor himself will be acting as an next of kin and mannequin will be acting as a patient. It's a tricky scenario, and we will see how you are going to manage the situation one by one. The other point is, I told you around 70% is communication, and around 30% is the skill task that's going to do. The skill, most of the students are aware about the skill that you have learned in the graduation or diploma program or basic nursing training that you have undergone in your country. But there are certain differences in the skills there, and there are certain differences in the communication scenario as well. In communication, what they are going to look is, they are going to look into holistic care. That means you are going to approach the patient, and simultaneously the patient sometimes is looking for something else. For example, you are going to approach the patient at 10 o'clock with the medicine, and now the patient is looking for her grandson who is going for an interview, and whether she is going to make it or not. Or she was taken in the early morning as she was very sick, and she was taken by ambulance crew in the early morning, and her pet is alone in her home. So this has to be managed. Okay, so what is your job is, you have to link the allied team members to come in, so that they themselves will be managing these situations. So that is the point that you have taken into consideration. You don't need to bring anybody inside. What you have to do is, you have to bring in those persons verbally only. Just verbalize, I am going to bring in my activity coordinator. She is going to talk to your grandson, and she will come back with an answer in another 10 minutes. That's it. The other scenario, I am going to talk to my manager. So manager will be talking to your one of your next of kin, and she is going to take over your pet. So this is the way they are going to manage. So but you should be able to verbalize what is going to happen, or what is the escalation plan at this stage. That's the other thing, the holistic care. Holistic care means you have to look into every aspect of the patient. So even if you are approaching for one particular task, you have to look in for every aspect that is going to happen. The other one is everything has to be consented. Everything has to be consented. So consent is very important. So consent, typically what is going to happen in case of a consent is, there is no need for written consent. So for example, if I am sitting in my room and somebody is coming into my room, so this is my space. So if you are intruding into my space, what you have to do is, you have to look for my permission. So can I come in my room? That's okay. If I say yes, that's it, that's okay, perfect, come in. That's everything is consent. Likewise, when you are going to approach the patient, sometimes you have to touch the patient, you have to lift the patient's body parts, you have to lift the blanket, you have to wrap around the BP cuff, and all the stuff is going to happen. So every time you have to consent, you have to look for consent. But that consent is a verbal consent. There is no need for written consent. So you can ask the patient, can I do that? Can I proceed? Is it okay? If a patient says yes, that's okay, that's perfect, continue, go on. All these things are the consents. That's the way you are going to take the consent. Then next one is a patient choice. The examiner will be looking for whether you are giving choices for the patient. For example, myself is going to approach the patient, and I'm happy with the right arm for doing the blood pressure monitoring. But you have to talk to the patient. Do you have any choice over there? Okay, because everything the decision is patient is the boss, and that decision should come from the patient. You have to give chances for the patient to take a decision. So if you are going to ask the choice for the patient, which choice, do you have any preference, or do you like to go with this arm or that way? Okay, then the patient says, I have the choice of right arm, that is okay with me, or left arm, that's okay with me, or I don't have any choice, the USF can decide whichever arm, that's it. Okay, that's the way that you are going to participate, or you are going to actively involve the patient choice. Next one is empathy. Empathy means feeling with others. So you are going to talk with the patient and feel as if you are a patient over there. A patient is in pain, for example, a patient is in pain. Now what you are going to do is you have to talk to the patient as if you are in pain. So you can get a feel or understanding of what's going to happen over there. The next point is they are going to look in for communication, especially verbal and non-verbal communication. How you are going to approach the patient, how you are going to talk to the patient. Is it okay for the patient? Is it rude? Is it offending for the patient? And also non-verbal cues, something like your body language, how you are stand, your movement, your eye movement, body language, facial expressions, turn around, and all these things will be taken into consideration. Next is these are the important points they are going to look in. Okay, so we will see what is going to happen. The other points we will see. Next point, what you are going to look in, what I'm going to tell you about patient's ability. The examiner will be looking for patient's ability to understand instructions. So the examiner is going to give you some instructions, patient is going to give you some instructions, and you yourself is going to give some instructions for the patient. The patient should be able to understand, because your English should be good enough for a patient to understand and good enough for the examiner to understand. So that's another point you have to take into consideration. Then another is their physical capacity. You have to give us a or give some task or do some activity based upon their physical capacity. So are you taking into consideration the patient's physical capacity when you are going to approach the patient? That's also a very important aspect. Next one is support that is available for the patient. So if you are going to give you support, continuous support for the patient, that's also taken into consideration. The next one is when you are going to looking for a patient who is having visual or hearing impairment, how you are going to approach the patient. So all these things are being addressed as far as OSCE scenario is concerned. So as I told you, it's a 10-minute station and 2 minutes reading, 8 minutes performance. You have some chit paper will be given, or a chit book will be given for you, so that you can scribble the things and you can enter the station. So this is a brief about the basic introduction. Now we will look into what are the stations that's available over there. So the list that is given by themselves is itself says it's not limited to the means. That list is incomplete. The examiners or the examination team has every right to add additional points. As far as my information available, we have some additional points or additional stations that's available in the Australian system. We will look into that in a few minutes, but before that we will look into the stations that's given by the Australian system. So the first one is a physiological observation, where they will be looking into A to G assessment. That means the airway you have to look in, breathing you have to look in, then circulation you have to look in, then disability you have to look in, exposure you have to look in, then urine output you have to look in, and blood glucose you have to look in. So this is what is called the A to G assessment. That is, a scenario will come up in front of you where the patient is having some problem, or patient is ill, or patient is unwell at some stage, and your job is to do a physiological assessment. Okay, the next one is vital signs. You know the typical vital signs that you have to look in. The next one is calculating drug dosage. Drug dosage itself is not a station. It will come up with the oral medicine station. and also it will come up with the IV administration station where you have to calculate the rate and the dose and the stuff like that. Okay, the next one is about a subcutaneous injection, that is another station that will come up, and also there is a intramuscular injection, that's another station will come up. Then the other one is aseptic non-touch technique, where you will be given a task of changing the old dressing. Patient is having a surgical wound, so your job is you have to take out the old dressing, and then you have to attach a new dressing. So that is also another important point. It's a very important station. Then the next one is in-hospital resuscitation, where you will be giving a chance for managing a rest patient. That means the patient is unconscious, the patient is not responding, where you will have to initiate the whole problem, whole scenario. You have to take the lead role. That's very important. Okay, the next one is safe disposal of sharp. Safe disposal of sharp is not an actual station, where they will be constantly monitoring the safe disposal of sharp in every station wherever the sharps are being produced or as a waste. Okay, next one is medication administration, as I told you, that is there. Then wound care, that means a wound assessment. They are going to look into something like with an acronym that's called a time. We will look into that at some stage. Then hand hygiene is there. Then another is the therapeutic patient communication and consent. That means how you are going to consent with the patient and how you are going to communicate with the patient. So that's constantly observed. The next one is infection control practices is there. Then next one is intravenous therapy and administration management, that is there. Then risk management, the clinical enrollment, especially the fall risk assessment, where the patient is having a newly administered patient and the patient is having a high fall risk, and your job is you have to look in for the fall risk assessment. So these are the important stations that's given by themselves. Then the other stations that will usually come up as far as OSCE is concerned is one is neurological examination. I told you pain assessment is there, non-pharmacological pain management will be there, mental status examination will be there. Then next one is the therapeutic communication, that is isobar handover, where the nurse is going to give you a handover to a nurse, for example, daytime nurse to night nurse to daytime nurse. That scenario will be replicated in front of you. So your job is to give a handover to the examiner. Examiner will be acting as a person who is going to take over the patient. Then there is an acute station where the patient will be having a blood reaction. Severe blood reaction is happening over there. It's your job to manage the blood reaction station. Then the next one is blood sugar monitoring is there, and hygiene is there, infection control station is there that I told you. 3-point ID check is there. Then the other one is urine MSC and dipstick, calculating drug dosage, and blood sugar assessment that I told you. Safe disposal of shock, whole risk assessment, and clinical deterioration. So these are the different stations that's going to happen in the OSCE scenario. Then we will see what are their criteria. They are not going to give much information about the criteria, but it looks like this is where the information is quite similar to the British OSCE scenario. So we will see what is going to happen, the examiner's expectation as far as different station is concerned. One is clearly explaining care. So whenever you are going to approach the patient, you have to clearly explain the care for the patient. That's very important, especially the diagnosis, investigations and treatments. There is no need for explaining all these things in every station. If the scenario will come up in which you are going to take the patient for some management, some training, or some admission or discharge or some treatment, then that has to be explained. There is no need for in every station this has to be explained. No, there is no need for that. That's if the situation warrants, you have to go for that. Then involved patient decision making. So it's your job to take a decision, to give a chance for the patient to take a decision. So you have to give choices for the patient, and the patient have to pick which decision I am happy with. This is the way I am happy, or that's the way I am happy. So that's what examiner is looking for. The next one is communicating with the relatives and other healthcare professionals wherever applicable. It's not mandatory. If the situation warrants, you have to talk to the family member. If you have to talk to the allied health team. So it's your job to talk with them, and it's your job to familiarize with them, to interact with them, and to refer them, and to bring back or back referral or whatever it is. So that's going to happen in every station if situation warrants. Seeking and obtaining informed consent. So I told you, everything has to be considered. That's examiner is looking for. Next one is active listening, because the patient is confused, the patient is worried at some different stages, and it needs some time for the patient to take a decision, and the patient is worried about so many things. So a patient is going to bring out her concerns. It's your job as a nurse, as a holistic care nurse, to assess or to manage or to observe or to listen to all these things at a time. That's called active listening. So you have to listen patiently what patient is going to tell you. But there are certain scenarios in which patient is talking, and you don't have time to manage. So you have to stop the patient nicely. For example, the patient is Mary. Ask the Mary, let's stop for a minute, and I will finish my procedure, and I will come back to you. That's the way you are going to stop the patient. Stop should be nicely. It should not be rude enough for the patient at any point of time. That's what examiner is looking for. So that's active listening. So you have to listen actively when the patient is talking, because there are scenarios that will come up in front of you where the patient is talking or the family member is talking. Next one is dealing appropriately with anxious patient. There are patient will be anxious, patient is worried, patient is too much under pressure. So it's your job to go behind the patient and interact the patient and familiarize with the patient and make the patient's anxiety to bring down. Also, there are certain scenarios in which the examiner will give you some unusual reading. For example, patient is going to get a blood pressure of 250 over 100, it's too much. Or the patient is going to get a blood sugar of 25, it's too much. What do? You have to talk to the patient, because we cannot hide this information from the patient. That's what is going to happen in the OSCE scenario. When you are going to give the patient information, don't give this information as if you are you are very sick and you are going to in a very serious condition, something like your blood pressure is 250. So tell the patient, your blood pressure is a small bit high. I'm going to talk to your manager and I will come, or I'm going to talk to your doctor and I will come back to you. So that's why you are going to manage the situation, because every station has to be proactively managed. It has to be referred. It has to be, the holistic care has to be taken into consideration. The plan has to be escalated, because whenever there is a need come in. For example, you yourself as a nurse, you cannot manage everything. So whenever there is a need come in, you have to include allied team members. For example, doctor has to come in, physiotherapist has to come in, or a dietitian has to come in, so speech and language has to come in, specialist nurse has to come in. So these things has to be done by the nurse. The examiner will be looking for whether you are involving all these persons inside the care. That's very, very, very important. Okay, now you just prompt what is going to happen. I'm going to talk to the doctor, and doctor is coming for review straight away. That's it. There is no need for bringing in the doctor. You're prompting. That means just talk. That's it. Next one is providing clear instructions on discharge. That means instructions, how you are going to give instructions. For example, at any time you have to go for instructions, even at the time of discharge, what things has to be done at the time of discharge, where you have to come in, what time you have to come in, what are the warning signs, what time you have to approach, where you will get the medicine, where you will get the support. So all these things has to be discussed. If the situation warrants, there is no need for in every station you are going to talk about discharge. No. If the situation warrants, if the station says the patient is going for discharge, now your job is you have to talk about this one. Okay, next one is demonstrating compassion. So every station you have to demonstrate compassion. Compassion means respectful, dignified empathy. That you have to give the respect for the patient, you have to give dignity for the patient, and you have to give empathy for the patient. So this is the way you are going to approach the patient. Okay, so that examiner is continuously looking for. Next one is a clear documentation. So three aspects you have taken into consideration as far as Aphra is concerned: what you have done, what is the patient response, and what is your interpretation. So three aspects has to be taken into consideration whenever you are going for documentation. The other point you have to go for documentation is your name. That means print your name means you have to write your full name and your date and time and signature. So all these things are the part of documentation. So even if you are successfully completed the station, you did a heroic job, but you are not documenting, but that means that's the examiner's interpretation is that is not evaluated. So that's a hard decision at that stage, but that's the way that system works in the Australian system. So you always keep an eye on documentation. The other point is I have seen some students are looking for or putting the sign in advance. That's cheating, and that will definitely result in failure. So once you haven't done your station, if you are going for documentation, that is considered as cheating. So that should not happen. So you finish your task, straight away go for documentation. So these are the different stations that you are going to experience, and these are the different common points. So these are the common different points you have to keep into consideration as far as Australian OSCE is concerned. In the coming sessions, we will be discussing about different stations, how you have to approach the station. So my plan is when you are going to get the second bell, so you have to approach the patient, how you have to approach the patient, and how you have to perform the task. So I'll be discussing everything one by one in a series of sessions that's going to happen. Also, I have plans for UK and Irish scenario as well. Myself is Bimel. I'm working with MWT Academy in Kottayam. So if you are looking for a training, if you are looking for further training, please do contact us. We have facility for online training and we have facility for offline training. It's a 1-week program starting from Monday to Friday. If anybody is interested, we have some extended time will be given for every student in order to practice their skills, to refine their skills, to match up to the levels until they get confident, and as well as the time constraint as well, because there is a point of time constraint that's applicable in the Australian system. So if you are looking for extra time, we will be giving extra time for another 3-4 days, so they themselves can practice and they can familiarize and they can refine their skills as well as their timing for the OSCI system. We will be giving language support, we will be giving a way to communicate, we will be giving documentation, we will be giving hand-on skills. So everything, your body language, your approach to the patient, and everything is being trained and refined, so that we will make you a good nurse for the OSCI scenario that's going to happen in Australia, that will make you pass in the OSCI scenario there. So I'm going to stop for now, and we will continue the rest of the sessions in the following series of videos. Thank you very much for listening with us.